Hey everybody, now let's talk about something that's going to cheer you up. Disease, otherwise known as morbidity, and death, otherwise known as mortality. We'll start with disease and where it happens in a group of people and where it does not happen. Now, when we look at the pattern of disease in a population, it shows us that diseases occur more in some places and less in other places for any number of reasons. Now, this is a very, very basic description of the study of epidemiology. Epidemiology identifies the distribution of disease in a population and figures out why. Now, as it turns out, social and economic factors are big determinants of who will be sick and where. As we know, social factors are huge here and include things like poverty and lack of education and social exclusion. But let's focus for a moment on one significant economic factor: income. Not only does income reflect access to resources like educational opportunities and social mobility, but there's also a strong income gradient in health. This means that as income decreases, so does health. Now, this applies to various outcomes, including high rates of chronic disease, mental health disorders, and infectious disease mortality. In addition, morbidity studies have shown that people with lower incomes have shorter lives. Okay. This brings us to zip codes. Zip codes? There's a strong connection between postal zones and disparities in morbidity and mortality. Zip codes also can be used as a proxy for social economic status, including income, which significantly impact health outcomes. Now, significant differences in life expectancy have been observed between different zip codes in the same city. Expectancy gaps of 20 years or more. For instance, a study in Dallas found an 18-year difference in life expectancy for residents living just 6 miles apart. Studies have also shown that women in lower income zip codes may experience high rates of maternal morbidity and complications during pregnancy. Now, these examples are just the tip of the iceberg. The bottom line is, if you live in a high income zip code, you are more likely to be healthier and live longer than if you live in a low income zip code. Okay, so here's a question. Given the fact that you're going to live longer in a high income zip code, does that mean you're more worthy of life than these who live in a low income zip code? Let me ask that question again. Let's see if we can think about that a little bit more. It's a tough one. Given the fact that you're going to live longer in a high income zip code, does that mean you're more worthy of life than those living in a low income zip code? Based on what? Wealth? Hold that thought. After all, government does not determine who is worthy of life. Until now. Medicaid provides health insurance for adults and children with limited income. Specifically, Medicaid expansion has been linked to reductions in deaths from conditions like cardiovascular disease and respiratory disease, as well as improvements in conditions like diabetes and mental health conditions. Now, Medicaid expansion has been linked to reductions in overall mortality rates and all case mortality rates. Okay, this is critically important. If Medicaid were to be cut as proposed, government crosses a complex ethical and philosophical line and makes the determination that one life is more worthy than another. That deals in pseudoeconomics are careless predictors of the death of some and not of others. Deal? I don't think so. I don't think so. All right. Thank you.